100 million people live with chronic pain. It's more widespread than cancer, diabetes, and heart disease combined.
But often people don't know the self-management skills that are essential to cope with chronic pain. UW Health distinguished psychologist Shilagh Mirgain is back with us today. Hi, Shilagh. Good to see you.
Great to see you both.
Great to see you as well. And first off, we're going to talk about a new research study for people with opioid-treated chronic pain. It's called the STAMP study. Tell us about
which
that.
stands for Strategies to Assist in Management of Pain study, and it's funded by a national organization, Patient-Centered Outcome Research Institute, and it's a 3-site study. UW Health is the primary site. It's for people with chronic back pain who are on opioids. Although the study doesn't really address medication management, what it's doing is comparing 2 psychological treatments, really seeing which ones are effective for which people, with the thought that it'll not only improve pain, but also enhance quality of life and functioning. It doesn't depend on what insurance you're on. It's really available to anyone, and people get paid to participate. So if people are interested, and I think a lot of people on opioids are interested in finding other ways of managing their pain. Some doctors are tapering them down or just really wanting to learn self-management skills. They can look at the website, which is www.stampstudy.org, or the phone number is 608-212-6902.
And their position's still open. You can get in.
Yes. We would love to have people explore it and look into it.
So people without opioid-treated pain, what other things can we do to sort of calm the body down and stop the pain a little bit?
Yeah, I always think we want to adopt a self-management mindset. Pain can create this vicious cycle of pain leads to lower mood and lower functioning and isolation, and people's lives start to shrink, and medication management is only 50%. Self-management, really adopting skills we can use day in and day out, really helps improve quality of life and really build a new normal. And there are 3 main areas that these studies address, and I also teach a lot of the patients with pain that I work with these skills.
And what are they? What are the main areas?
The first is mind-body skills to really calm and center the central nervous system. Pain is such a stressor. It can create a lot of cortisol in the system, a lot of tension. All of that makes pain worse. So things like mindfulness meditation, slower, lower breathing can really help re-regulate and can really lower pain as well.
But if you have, like I have the shoulder problems, I mean, it's not going to go away.
Yeah.
So how do I deal with that until I get it treated?
Right. Well, I think, so in addition to relaxation or mindfulness, number 2, really working on pacing your level of activity. Because pain can drain a person, it can contribute to sleep difficulties, you have less energy. One author talked about she only had so many spoonfuls of energy, maybe 8 spoonfuls, and she had to be mindful of how she was using those spoons. So pacing yourself, building in rest breaks, so you're really enhancing what you can do with what you have in terms of energy that day.
And what is your third tip?
The third is really managing what's up here, because often it is, because pain is so negative in the body, it can create a lot of negative thinking and patterns like catastrophizing, thinking the worst. Mark, if you thought, the shoulder, oh my goodness, if this doesn't go away, I'm going to have to amputate my arm. Your mind can go into this doom and gloom thinking that would create a lot of additional suffering. So what I encourage people to do is create balanced thoughts or coping thoughts to keep the mind more neutral in the moment and always have a sense of hope, because even if we haven't figured out the pain today, you never know with medical treatments like the STAMP study what we might be figuring out to really help this, what we consider a silent epidemic of all these people struggling with pain.
It starts with lower back pain, and it's a downward spiral for a lot of folks. Again, that STAMP study, can you get involved how?
It's www.stampstudy.org, and instead of that downward spiral, we're really looking at creating victorious cycles for people.
Well, it's great information, because one of the parts of the opioid epidemic we don't talk about as much is sometimes people who need pain medication now are actually having trouble getting it. So this gives you strategies to kind of help yourself. And I'm a big believer in the mind-body connection, that, if you can calm yourself down, that's a big step toward healing, right?
Yeah, and the study, because it's 2 different psychotherapies in groups, the other benefit is you get that social support of being around other people in this group treatment. Both are 8 weeks long, so I think people really enjoy that as well.
There is help out there. Doctor, thanks for being with us again.
Great to see you, Shilagh.
Yeah, thanks so much for having me.
See you next time.